Welcome back. Despite multiple warnings not to use ivermectin, Washington Poison Center has seen a huge increase in calls regarding ivermectin. And joining me this morning to talk about this, Megan King and Stephanie Garland with the Washington Poison Center are here. Good morning to you.
Good morning.
Well, good morning. So talk a bit about the increase in calls and why you're seeing that.
Yeah, so we are seeing significantly more calls this year than we normally do. So far in 2021, we have helped 33 people with ivermectin, either questions about ivermectin or exposures to it. Most of those calls have actually happened in August. We had 18 total. There were 5 people who called about questions, and then there were 13 people who were calling to seek medical treatment after being exposed to ivermectin. This is a lot more than last year. 2020, we only handled 9 calls.
Okay, so I know that Joe Rogan, for example, who got COVID, said he was taking ivermectin to treat it. Ivermectin, by the way, an anti-parasitic drug. It's used to treat river blindness, intestinal roundworm infections, and also to deworm pets and livestock. There are lotions and creams containing ivermectin to treat head lice and rosacea. But in this case, do you think people are taking it because maybe COVID symptoms?
Yeah, so a lot of the calls that we're getting are regarding people that are using it inappropriately. As you alluded to, ivermectin is an FDA-approved prescription product for certain indications, but what we're seeing now are people that are taking either the human prescription in a much higher dose than it would be typically prescribed, or they're using animal veterinary formulations that are not formulated for human use, or they're swallowing the topical formulation, which those inactive ingredients, while they're safe on the skin, are not safe to have inside the body. And those are the calls that we're getting where people are having more problems than typically seen with a regular therapeutic use.
Okay, so what problems are you seeing, and why people maybe shouldn't take ivermectin if it's not prescribed to them?
Sure. So ivermectin has many drug interactions, and the doses that are being used right now are much, much higher than have been studied in humans. A horse medication usually has a much higher concentration because horses are so much bigger than humans. When you take too much of ivermectin, you can see nausea, vomiting, diarrhea, and then even more severe symptoms such as confusion, not knowing where you are, not knowing who your family members are, low blood pressure to the point of being dizzy and falling, and even a seizure, as well as just dizziness and not doing well overall.
Well, there's a lot of misinformation out there about COVID and about ivermectin. So can you talk a little bit about that and the misinformation that's going around?
Sure. So there is clinical trials that are published, but none of them meet the FDA specifications of having sufficient evidence to support use for ivermectin in COVID patients. Now, there are clinical trials by the National Institute of Health that are being done, but those have not been completed and those results are not in yet.
Okay, so
Megan, did you have anything to add?
Yeah, and I think just along the lines of misinformation, what we're really concerned about is people who are self-medicating with ivermectin. We really want folks, if they're going to use ivermectin, to do so under the supervision of a medical provider and not to use for themselves without any of that supervision, not to go and obtain veterinary formulations or to take prescription formulations and take them in.
Okay, what are the real dangers of overdose and misuse with ivermectin? What will it do to us?
Yeah, so we haven't seen any severe toxicities thus far, thank goodness. We have seen pretty significant mild and moderate symptoms that have required hospitalization and medical attention. And those would be the seizures, the low blood pressure, the extreme confusion. Those are the things that we've been significantly worried about. And then the vomiting and diarrhea can be so severe that you need IV fluids and electrolyte replacement, that it's not something that you could just drink a Gatorade and fix.
Yeah, okay. Megan King and Stephanie Garland with the Washington Poison Center getting to the bottom of that for us. We appreciate your time. Thank you.
Thank you.
Thank you.